So first we will discuss in whom we should do screening for gestational diabetes. According to American Diabetic Association and Endocrine Society, it is recommended that we should do screening for gestational diabetes in high-risk group females. But in India, we are doing universal screening. That means every pregnant female should undergo screening for gestational diabetes irrespective of risk status, because India is the second largest country after China to have a maximum number of diabetic persons. So if we do screening only in high-risk females, a large proportion of gestational diabetic females will be missed, and that may lead to a poor and abnormal complications for the baby as well as the mother. So that's why in India we are following the universal screening. Second, when should we do screening for gestational diabetes? Ideally, as gestational diabetes is a diabetes that occurs because of pregnancy hormones, and the level of pregnancy hormones is at peak after the 5th month of pregnancy. So, to screen for gestational diabetes, it is recommended to do screening test after 5th month, that is between 24 to 28 weeks of pregnancy. So, does it mean that there is no need for blood glucose testing in the first trimester? No, it is not like that, because many of us are already having a prediabetes or diabetes, but we are not aware of that. And if we will do screening for diabetes only in the second trimester, we can miss the high blood sugar level in the first trimester. And this high level of blood glucose may lead to the abnormal complication in the terms of congenital birth defects in a baby. So, all pregnant females should be tested for sugar at their first antenatal visit by checking the fasting sugar or HbA1c. If sugar level is normal, then they should recheck or undergo for the screening of gestational diabetes between 24 to 28 weeks. Now, how we diagnose gestational diabetes? So, to diagnose gestational diabetes, Endocrine Society and American Diabetic Association has recommended a gold standard test, that is 75 gram oral glucose tolerance test. In this test, we advise for a fasting of 8 to 10 hours. That means after taking your dinner by 10 or 11 pm, do not take anything till morning and come to the nearest hospital or lab in a fasting state. At that time, one blood glucose sample will be taken, and after that 75 gram of glucose drink will be given. After 1 hour and 2 hours of the glucose drink, the two blood samples will be taken respectively. If the 0 hour value is more than 92 milligram per deciliter, or 1 hour value is more than 180, or the 2 hour value is more than 153 milligram per deciliter, then it is considered as a positive screening test. So why we have taken these values as a cutoff values? We can take a fasting of 95 or 100. These cutoff values are based on the results of some important studies. One of them is HAPO study. The results of this study were published in 2010, and they have suggested that when blood glucose level is more than these cutoff values, there is high risk of having a large size of baby. There is high risk of getting a high insulin and C-peptide levels. That's why these cutoff values are used for the diagnosis of gestational diabetes.